ALL, we have a less clear understanding of the pathogenesis, how the disease develops. That much is certain. What's interesting, though, is that we have many more agents that seem to be applying across the board to most cases of ALL. Most strikingly are those that are simply targeting a common protein on the outside of the precursor B-cell ALL cell, which is called CD19. So there are two targeted therapies to CD19. One takes a simple antibody conjugated to a poison, the drug is called Inotuzumab. And so that's very indiscriminate. Any pre-B ALL cell usually has this CD19 on it, and you throw this, essentially a drug antibody conjugate in there, and it clearly improves the survival of these patients. A more technologically sophisticated approach, you might call it, is Blinatumomab, and that is a fascinating construct called a bispecific T-cell engager, which links CD19 on the T-cell to CD19 on the B-cell to CD3 on the T-cell, drags the T-cell over to it, and the T-cell can bestow the kiss of death upon the pre-B ALL cell. That drug is called Blinatumomab, and we knew it was very active. It received accelerated approval in many parts of the world based on single-arm studies. And the results presented at this meeting here yesterday afternoon show that Blinatumomab, when in a randomized trial versus anything you want to try, doctor's choice of chemotherapy, won fairly easily in overall survival, pretty much as we thought it would. But that study is very important because that will likely, I don't know, I'm not involved in its development, but that seems to me it will result in full approval of Blinatumomab. Because typically after accelerated approval, you have to demonstrate an improvement in overall survival, which they've done now. So quite exciting news. There's really a new drug, and it is quite the opposite of AML. AML, all the general top treatments didn't seem to work because the disease is so heterogeneous that you're using one treatment for 20 different diseases. Perhaps precursor B-cell ALL is a more uniform disease. I don't know. But particularly in the adult world, where it's driven by some very nasty drivers, we just haven't found anything to target it yet. And so we're using very general approaches, immunotherapy. And so this is really immunotherapy. So perhaps for AML, the immunotherapeutics are going to work likewise broadly across all of them, although they're further behind than the ALL field.